Have you ever brushed off a persistent headache? Or perhaps a sore that wouldn't heal? What if these everyday symptoms were your body's way of signaling something far more serious? We're about to uncover the 8 warning signs that could save your life. It's time to listen closely to your body, because ignoring these signs might mean missing out on early detection, which can make all the difference. Stick around to learn the signs you can't afford to ignore. Before we dive into the video, please subscribe to our channel for more informative videos. Now back to the topic. 1. Weight loss. Unexplained weight loss. Unexpected weight loss can be one of the most unsettling signs your body is trying to tell you something is wrong. Losing weight without changing your diet, exercise routine, or lifestyle could be an early warning sign of cancer. In fact, this unexplained weight loss, also known as cachexia, is common in many types of cancer, including those of the pancreas, stomach, esophagus, and lung. When cancer cells grow and multiply, they often consume energy at a rapid rate, which may cause your body to break down muscle and fat, leading to significant weight loss. This process can happen even if you're eating normally or more than usual. Additionally, cancer can trigger hormonal changes or cause your body to expend more energy than usual, contributing to weight loss. If you experience a sudden, unexplained weight loss of 10 pounds or more over a short period of time, it's crucial to seek medical attention. Along with weight loss, other symptoms such as fatigue, loss of appetite, and nausea may accompany the condition. These signs should never be brushed off, as they can indicate that the body is struggling with more than just a minor illness. Catching cancer early is key to preventing further progression, and many types of cancer can be treated successfully if detected early. If you notice unexpected weight loss, don't wait for it to go away on its own. A healthcare provider will likely perform diagnostic tests to determine the underlying cause and provide the best course of action. 2. Pain. Persistent or unexplained pain. Pain is a symptom that can signal a wide range of health issues, from something as mild as muscle strain to more severe conditions like cancer. However, when pain becomes persistent or unexplained, it could be an early warning sign that something more serious is happening inside your body. Cancer, in particular, can cause pain as tumors grow and press against organs, nerves, or bones, or when cancer spreads to other parts of the body. The type of pain you experience depends on where the cancer is located. For instance, if a tumor is growing in the abdominal area, it might cause stomach pain, bloating, or discomfort. Bone cancer may cause deep, aching pain, particularly when moving or applying pressure. Cancers that affect the lungs, such as lung cancer, can lead to chest pain or a persistent cough that may worsen over time. One of the crucial aspects of cancer-related pain is that it doesn't typically go away on its own and often becomes worse over time. If you are experiencing pain that doesn't seem to improve with over-the-counter medication or rest, or if the pain is unusual or different from any pain you've experienced before, it's time to speak with a doctor. Early detection of the source of the pain is essential, as many cancers can be treated effectively if caught early. Pain is your body's way of telling you that something is wrong, and while not all pain is cancer-related, ignoring persistent pain could allow a serious condition to worsen. Don't wait for the pain to go away on its own. Get evaluated by a healthcare provider who can help determine the cause and offer appropriate treatment options. 3. Swelling. Unexplained swelling or lumps. Swelling can occur for many reasons, from a sprained ankle to fluid retention or an infection. However, when swelling appears without any obvious cause or seems to get worse over time, it may be a sign of cancer. Swelling, particularly in the abdomen, lymph nodes, or legs, could indicate that a tumor is pressing against nearby tissues, or that cancer has spread to other areas of the body. One common area where swelling can be a sign of cancer is the lymph nodes. Lymphatic cancer, such as lymphoma, often causes swollen lymph nodes, which can feel firm, and may be painful to the touch. Swelling in the arms or legs can also be caused by cancers that affect the blood vessels or lymphatic system, like certain types of leukemia. In some cases, swelling in the abdomen can indicate ovarian, liver, or pancreatic cancer. Swelling is different from simple puffiness that comes and goes, as it tends to persist and may worsen over time. If the swelling is accompanied by other symptoms, such as unexplained weight loss, fatigue, or pain, it should be evaluated by a healthcare professional. Even if swelling seems harmless, it's important to get it checked out, as early detection of tumors can lead to more effective treatments and better outcomes. If you notice any unexplained swelling in your body that doesn't subside, particularly if it's accompanied by other concerning symptoms, it's crucial to seek medical attention. Your doctor can perform imaging tests or biopsies to find the underlying cause of the swelling and determine the next steps for treatment. Night sweats, excessive sweating at night. Night sweats, which are defined as excessive sweating during the night that soaks your clothes or sheets, are a common issue that most people experience at some point. However, when night sweats occur without any apparent reason, especially when accompanied by other symptoms, it can be a warning sign of an underlying condition like cancer. Certain cancers, particularly lymphoma and leukemia, are closely associated with night sweats, often appearing alongside other symptoms like fever and unexplained weight loss. The exact cause of night sweats in cancer patients isn't always clear, but it's believed that the body's response to cancer and its immune system's efforts to fight the disease might trigger excessive sweating. In lymphoma, for example, night sweats are often one of the first symptoms to appear. These sweats can come on suddenly and can be so intense that they wake the individual from sleep, leaving them drenched in sweat. If you are experiencing night sweats regularly, particularly if they are unexplained and persist for weeks or months, it is important to seek medical advice. You should also be concerned if these sweats are accompanied by other unusual symptoms, such as fatigue, fever, unexplained weight loss, or a persistent cough. These symptoms may indicate the presence of a more serious condition, including cancer. While night sweats can also be caused by non-cancerous conditions, such as infections, menopause, or medications, persistent and unexplained night sweats should never be ignored. A healthcare provider can help determine whether these sweats are linked to cancer or another health issue, and early detection can significantly improve the chances of successful treatment. 5. Persistent cough, chronic cough, or coughing up blood. A persistent cough is often a sign of a common cold, allergies, or respiratory infections. But when a cough lingers for weeks or worsens over time, it can be a red flag for more serious health issues, including cancer. Specifically, lung cancer is a major concern when a persistent cough doesn't go away, especially when it's accompanied by other symptoms like chest pain, shortness of breath, or coughing up blood. Cancerous tumors in the lungs or airways can irritate the lining of the lungs, causing inflammation and triggering a chronic cough. The cough may start off mild and gradually worsen, or it may appear suddenly with no prior history of respiratory problems. If the cough becomes persistent and doesn't improve with standard treatments like over-the-counter medications, or if it is accompanied by blood, it is important to seek medical attention as soon as possible. In addition to lung cancer, a persistent cough can also be a sign of throat, esophageal, or even stomach cancer, as tumors in these areas can impact the airways, leading to frequent coughing. If the cough is producing blood or a significant amount of mucus, it's critical to get evaluated by a doctor. If you've had a cough that has lasted longer than 3 weeks, or if the cough suddenly worsens or becomes painful, don't wait. A healthcare provider will likely conduct a physical exam, chest X-rays, or even a CT scan to identify the cause. Catching a serious condition like lung cancer early on increases the likelihood of successful treatment, making it all the more important to address persistent coughs promptly. 6. Skin and mouth sores, unhealing or painful sores. Skin and mouth sores that refuse to heal or that keep reappearing should never be dismissed. While they are often caused by common conditions like infections, ulcers, or irritation, persistent sores that don't heal properly can be a sign of a more serious issue, including cancer. Oral cancers, skin cancers, and cancers that affect the immune system can cause these types of sores or lesions to form and persist. In the case of skin cancer, certain types, like squamous cell carcinoma or melanoma, can cause open sores or lesions on the skin that don't heal. These sores may be painless at first, but can become painful over time. The sore might have an irregular border, appear discolored, or bleed. If you notice a lesion or sore on your skin that doesn't heal within a few weeks, or if it changes in size, shape, or color, it's important to seek medical attention. Similarly, mouth sores or ulcers that don't go away within a few weeks could indicate the presence of oral cancer. These sores may appear on the gums, inside the cheeks, or on the tongue. Along with the sore, you may notice other symptoms such as difficulty swallowing, pain when chewing, or unusual changes in taste. If these mouth sores persist or worsen, it's essential to get evaluated by a healthcare professional. Early detection of skin or mouth cancers is critical because these cancers can be treated successfully when caught in the early stages. A dermatologist or dentist can help diagnose the cause of the sores and recommend appropriate treatment options. If the sores are linked to a more serious condition, such as cancer, prompt treatment can greatly improve the chances of recovery. 7. Persistent headaches, unexplained or severe headaches. Headaches are a common occurrence for many people, often caused by stress, dehydration, or lack of sleep. However, when headaches become persistent, unexplained, or increasingly severe, they could signal something more serious, including cancer. Specifically, brain tumors or cancers that affect the nervous system can cause recurring or intense headaches. These headaches may be different from your usual tension or migraine headaches in terms of intensity, duration, or the areas they affect. A tumor in the brain or surrounding areas can increase pressure within the skull, leading to headaches that may worsen over time. If you experience headaches that are not relieved by typical over-the-counter medications, or if the pain becomes increasingly intense, it's important to pay attention. Headaches associated with brain cancer often become worse in the morning or when you change positions, and they may be accompanied by nausea, vomiting, vision problems, or seizures. In addition to these symptoms, certain cancers, such as those affecting the lungs or breast, can spread to the brain, causing secondary, metastatic brain tumors. These tumors can result in chronic headaches, changes in mental function, and other neurological symptoms. If you are experiencing persistent headaches, particularly when they are accompanied by any of the warning signs mentioned, it's essential to consult with a healthcare provider. A doctor can perform diagnostic imaging, like an MRI or CT scan, to determine whether there's a tumor or other underlying cause. Early detection and treatment are crucial for improving outcomes, as tumors in the brain can often be more easily treated if caught early. 8. Mouth changes, sores, lumps, or changes in taste. Changes in your mouth, whether it's sores, lumps, or a sudden change in taste, should not be ignored. While some changes can be related to common issues like a cold sore or infection, persistent or unusual changes could signal something more serious, such as oral cancer or other cancers affecting the mouth, throat, or digestive system. Oral cancer can cause symptoms such as sores, lumps, or lesions inside the mouth that do not heal after a few weeks. These sores may be painful or just irritating, but they often persist and may appear on the gums, tongue, lips, or the roof of the mouth. In some cases, the inside of the cheeks may also develop unusual patches or lumps. If you notice any of these changes, particularly if they bleed easily or cause difficulty with swallowing, speaking, or chewing, It's essential to see a dentist or doctor immediately. Another common change that could signal a health issue is a sudden, unexplained change in taste. If your food tastes different, or you experience a persistent metallic or sour taste in your mouth, it could indicate oral cancer or other types of head and neck cancers. These changes can also be linked to issues with the salivary glands or even gastrointestinal cancer that affects the way food is processed and perceived by the mouth. In addition to these symptoms, persistent bad breath, halitosis, difficulty swallowing, or changes in speech should not be overlooked. These could be early signs that cancer is affecting the mouth or throat. It's important to have any unusual oral changes evaluated by a healthcare provider, as early detection can lead to more successful treatment outcomes. Even if the changes seem minor, getting them checked by a professional is always a good idea. The earlier you catch something, the better the chance of treating it effectively. Don't wait for symptoms to worsen. Seek help as soon as possible. Your body speaks to you every day. Don't ignore its messages. If you notice any of these warning signs, it's time to take action and consult a healthcare professional. Early detection can significantly increase the chances of successful treatment and recovery. If you found this video helpful, make sure to share it with your friends and family so they too can be aware of these critical signs. Remember, your health is your greatest asset. Take care of it. For more life-saving tips and health advice, don't forget to hit that subscribe button and turn on notifications. Stay informed, stay healthy, and together, we can fight cancer through awareness and early intervention.